Tens of thousands of South Carolinians have reached out to the national 988 Suicide and Crisis Lifeline since it launched a year ago.
They're among the millions of Americans who have sought help in a time of crisis during that time. State House reporter Mary Green has the details on how the state is adjusting to the increase.
South Carolina has seen a significant uptick in calls to the National Crisis Lifeline since 988 launched a year ago. But the state also has more resources now to get callers the help they need.
Having three numbers, I think, makes it more accessible to people.
The year before 988 launched, about 30,000 calls from South Carolina area codes came into the National Suicide Prevention Lifeline when it had a 10-digit phone number. In the last year since that switch to 988, the number of calls jumped up to more than 38,000. That doesn't include people who reached out through text or chat.
This is also helping open the door for continuing to support other parts of 988 crisis care continuum, not just the call number.
Until last month, just one call center in South Carolina was taking these calls, but a second location opened up in June. Since then, the answer rate for calls from South Carolina area codes being answered by someone in South Carolina has gone up too.
We know our resources, we know the different accesses to care that we have across South Carolina, and other national backup centers can identify some of those things, but I think it can add another level of understanding when you are from and answering for a particular area that you are familiar with.
Starting with the new state budget that went into effect July 1st, South Carolina's 988 call centers will receive recurring dollars to fund their work, meaning they'll have consistent funding.
That's what we needed, something to have to know that, okay, we have these reoccurring monies coming in, and that's going to help further support our crisis resources in South Carolina.
Also important to note that the Department of Mental Health says calls do not go unanswered. If someone in South Carolina can't get to it, then a call will be rerouted to a national call center in another state that also has access to help and resource information. Reporting from the State House, I'm Mary Green.